Hello and welcome to the Health Share Exchange University podcast series. I'm Dr. Brian McDonough, and joining me today is Dr. Palak Raval-Nelson, Health Commissioner for the Department of Public Health for the City of Philadelphia. Prior to accepting the role of Commissioner, Dr. Raval-Nelson served in numerous capacities, including Deputy Public Health Commissioner, Administrator, Director of Environmental Health Services. She's an author, teacher at both Drexel and Temple. Dr. Raval-Nelson, welcome to the program.
Thank you very much, Dr. McDonough. Glad to be here.
You're in a very important and exciting role, especially for the health and the public health of our community. What do you see as the big public health issues in the city of Philadelphia from your standpoint?
So I think right now, given where we are from whether it's a federal level or a overall kind of state, local level, is really, it's about trying to keep public health is under such attack right now. So it's really about keeping us steady. Our mission is to provide a safety net for our most vulnerable Philadelphians. We serve all of Philadelphia, all 130 neighborhoods, 1.6 million people. So while and we have over 13 programmatic areas. So while we focus on the individual program areas, as health commissioner, my goal is to keep us steady in this realm and time space of turbulence in public health.
One of the big public health issues in just about every city is substance abuse, and clearly Philadelphia is no exception. How do you approach that? Because I know we have a large underserved population, and these people are some of the most challenged.
So in our city, and I believe you may be aware, Mayor Parker's first and foremost goal is overall wellness for the folks that are suffering with substance abuse issues. And the health department has our own substance use and harm reduction program, and we work in conjunction with the wellness center and the sites at Riverview and other sites. We also work with our Department of Behavioral Health and Intellectual Disabilities, as well as Office of Homeless Services. And we all fall under the cluster of Health and Human Services. So we work collaboratively to approach the problem to see how we can help people, with the solution that individual needs, while maintaining the balance with what the community needs overall as well. And having the capacity for folks to be in more than, like the capacity at the Riverview Wellness Center for long-term treatment and care. We work in conjunction with that in helping folks, as well as our substance use and harm reduction program works boots on the ground to help with all sorts of everything from warming kits during a code blue to just providing water during heat emergencies, and also focusing on the policy goals as well overall.
I would think in your role, it has to be a dream that Mayor Parker, that's her focus. It's got to make your world so much better, because I'm sure you can have really welcome conversations with the mayor.
Sure. And her overall platform, I've been with the health department for 29 years. I started out as a health inspector, and Kensington was my first assignment. That was my neighborhood where I did inspections. And overall, when you look at the city goals of wellness and cleaner, greener, safer, economic opportunity for all, and the home initiative, those are all social determinants of public health, right? So as a public health commissioner in this time, while things are turbulent and public health is under attack, to have the kind of support and this lens of collaborative work together across departments, and being able to just have these conversations that are fostered and facilitated, to work with the director of Office of Homeless Services or the police commissioner or the Office of Public Safety. It's really a welcomed experience. And overall, just I'm grateful to be in this role at this time. And that may sound odd, but I truly am. I feel like all of the experience of all of these years that I've had really lends itself for this time frame to be in this role as health commissioner.
Well, I know, as a practicing physician too, I know that a lot of what we're doing now, we're much more aware, not just of the social determinants, but of zip codes and where people are, and trying to get resources to people. I mean, part of the questions we now ask, it's about are you in a food desert? How are you as far as who lives in the home? Like, we always focus, but not to this extent. And I know that one of the big things from a data standpoint is PA Navigate and connecting community health organizations with providers. In your role, how do you see the role of something like PA Navigate using data to more or less connect people with their patients and who can get that help?
Sure. I mean, data is key to public health, right? And as I was thinking about our discussion, and I think about HSX, and I think about other spaces and platforms that collect data to help facilitate public health, I quite often think back to John Snow, the father of epidemiology, and the water pump. And there was and I'm sure you're familiar, but way back in Britain, when there was a cholera epidemic, and he started doing a map and looking at the data and trying to identify where was the disease occurring in proximity to this water pump, and he identified it. So I always hold that steady, that data is a resource to really help us. We can look at the subsets. Certain neighborhoods or environmental justice neighborhoods, certain neighborhoods need different things, and the data really provides the roadmap that we need to figure out what is the best way to intervene from a public health standpoint. And then also, if we have all these interventions and tools in our toolbox from a public health standpoint, some neighborhoods lend themselves better to one particular intervention versus another. And that's how we use the data.
It's interesting. About this time last year, I had a chance to interview Pennsylvania Secretary Arkush, who was talking about much the same thing, about the importance of data and how the fact we have access to it now and greater access can help people use that information to make decisions. And information is really, in public health, I would think that's got to be the foundation.
Absolutely. Information is absolutely key. I'm a big proponent of watching not just data, but also data trends and where we are heading. I'm an environmental scientist by practice. My degreeing and my training is in environmental science and looking at the environmental causation of disease and associated impacts. So having data sets, having the conversations with HSX about what are the other data sets that are available to us, or what are the data sets that maybe we can think about measuring, is so critical and key right now in this situation, this public health dynamic that we're in. And so having all of those pieces of information available helps us to make decisions that make sense. We use a systems thinking approach in the health department. And so having the data in front of us before we make a decision, we mitigate unintended consequences.
How could things get better, like sharing of data and trying to make it, more robust and serving more people? What would your dream be?
So my dream would be to really, you mentioned about zip codes and census tracts and things like that. So really getting to being able to drill down to census tracts and zip codes and getting details about a particular, so maybe looking at, for instance, looking at housing code violations in a particular block or a census area, and then overlaying cases of asthma, overlaying cases of lead poisoning, overlaying other such chronic diseases, and then looking to see where are the sites available for potential treatment and medical providers and care.
One of the things that I've seen in Philadelphia is it seems that many of the medical centers now are also sharing data, and they're sharing information on cases. One of the interviews we did with HSS, we actually talked with a number of centers that were finding out orphan cases where maybe somebody was in the middle of a different area, but it related to people who were in Philadelphia, and taking that information. Is that something you're doing as well now too, like looking outward and trying to see how it impacts Philly?
Absolutely. We have to. One of the areas that we would focus that type of, and the example that I tend to use is the wildfires that occurred in Canada. And so we have air quality monitoring stations throughout the city, and we keep track of the air quality because we know it has impacts on health, whether it's asthma or a host of other chronic diseases. And we monitor, and sometimes there's this notion of, well, we're in Philadelphia, so we're going to Philadelphia focus. Well, the air doesn't understand those boundaries, you know? And so when everything was happening with the wildfires, we had to quickly step up and step in and look at our monitors and our data and then translate that into good public health measures and put out advisories about masking and limiting activity and giving guidance, which was unprecedented. We hadn't done that before.
No, and it's funny. I think back on that. I have a little screen porch and like to watch sports sometimes in the early evening, and I remember smelling like smoke, but also coughing. I'm like, why am I coughing? And that was Canadian wildfires, and it just shows how if you were someone who had asthma, COPD, emphysema, that could put you in a crisis mode.
Absolutely. And it's funny that you say that because it was around, I think, I don't know, maybe 10, 15, and I was deputy health commissioner at the time. And I started smelling smoke, and air management is under my purview. And I thought, okay, there's a fire. We're going to have to send out, and we have our mobile lab. We have this really amazing new tool, and it's a mobile monitoring lab. And essentially we can drive around and measure air quality. So we can, in real time, make decisions about whether or not residents should keep their windows closed or keep them open. And I remember walking outside of my house, and I texted the then commissioner and I said, hey, I'm going to have to dispatch. Just want to let you know, I smell smoke and fire. And she's on the other end of the city. And she says to me, wait a minute, I do too. And so then we realized it's, and we activated and took charge and made sure that we had a policy to help Philadelphians to deal with the air quality and what public health messaging they would need.
I'm speaking, you're having a great conversation with Dr. Palak, Raval-Nelson, and one of the things I wanted to focus on a little bit, and I think you've already addressed it just by talking about how you were going around measuring air quality in different parts of the city, is providing care to people where they are and how important that is as well. I'm seeing a growing number of studies, whether it's in JAMA, New England Journal of Medicine, where they're actually looking at pockets of people, areas where maybe screening isn't done to the level it should, or cancer rates are higher. It is dramatic.
It is, absolutely. And this is why our health centers that we have located around the city of Philadelphia are key, because they're in neighborhoods. People can go and get access to care in those neighborhoods, as well as working with our partners throughout the city of Philadelphia to make sure that there's access to care. And where the data piece comes in is really figuring out how we can share that important data. So whether it's our public health lab, working with HSX, the portal to share, test result data and everything else, or our medical examiner's office. We use and we share data to help us understand, the cause of death and mortality, morbidity data. So it's a broad spectrum, and it really helps us to kind of look and understand. And sometimes the data will lead us. We may have an idea of what we think is happening, but then you look at the data and you start noticing nuances and realizing, there may be something else going on here.
I just noticed Harm has joined us. Harm, you had a question you want to bring up?
Just a brief addition to your conversation here. So my name is Harm Shiri. I'm the Chief Medical Information Officer at HSX. And you just talked about HSX having a Philadelphia regional set of data. And one of the topics where that comes into play is HSX and the city of Philadelphia are currently participating in a CDC-funded study specifically on regions in the city where we see higher incidence of hypertension and diabetes. So that is really focused on several big diseases, but that are concentrated in certain areas. So that's another example of using a large data set to help the public health department focus their initiatives.
It's absolutely key. We use the data to help not only make informed decisions, but also how we can be proactive and looking at upstream solutions.
While you're here, Harm, is there anything else you wanted to ask or you wanted to discuss that we could have in this conversation while we have a chance to speak with Dr. Raval-Nelson?
I want to go back to where you started in the beginning because I think it's worth going a little deeper on PA Navigate. It's a new project. And I think it's important to highlight this, that traditionally in the past, HSX, Health Share Exchange, was focusing on connecting healthcare organizations, hospitals, insurance companies, post-acute care. But now, because of PA Navigate, that extends to lots of community-based services, including Benefili, which is a service from the city that's now connected through PA Navigate. I think the realization that healthcare is much beyond our traditional health providers, and that becomes a growing network. I think that's important from a public health perspective. And I wonder if you could speak a bit more about seeing HSX not only as a data set, but as a network of connected organizations to provide that care.
Absolutely. And, I had the fortune of being on a panel for HSX earlier. I want to think earlier this year. Sorry, it's kind of the dates are kind of blending in. One thing that I have realized being health commissioner, you end up losing track of time because and so being on that panel and being in that room, I'll be honest, I was very awe-stricken to see all of the community collaboration and the community work, right? As a person who has worked in the community, regulated the community, come up through my my career, figuring out how to have collaborations and partners. The fact that HSX can bring groups together is so vital and so important because, again, public health is defined by the community that we're in. And sometimes when you're government, people may not, they see you as the government. And that right now, especially, it's like, do we invite them or don't we? And the fact that HSX is willing to take this on and not just be data, but to take this on and go ahead and put these groups together and create these collaborative networks is really key. One of the things that I got asked earlier this year was, this time around, there are no guardrails for the what's happening, regarding public health. And I said, we as collaborators, as partners for the greater good of public health, wanting to care, right? Here you have an organization, a company that not only wants to provide data, but also then have it translate into well-being of people, right? And so having that then creates this joined guardrail where we all can work together and we can explore. And again, my passion is where it is. I believe that there are a lot of environmental causations of disease. And I think expanding that and having those conversations is really important because on the other hand, we do talk to community groups and they'll say, hey, we're experiencing more of this here. Can you help us? And that's where HSX comes in again as a partner, as a convener, and a facilitator, honestly.
That's great. Anything else, Harm? Or?
Well, that was a great answer. And I love the way you described that. So that it's not just a data set, it's also a group of organizations, but it's also a group of people working together. I think they all come together, and I think it makes it very effective. And I love how you put that in the context of public health. That's fantastic.
I'm glad you jumped on. Thank you so much. And
thank you.
We've hit you with a lot of questions. Is there anything you want to bring up, Dr. Raval-Nelson, that you think we didn't talk about that you think would be important for us to talk about?
Not necessarily. We're just that we are in this realm and space of public health. And I think it's just really important for us to stay connected, stay grouped, stay inspired, right? I quite often share the Starfish story, and I hold on to the Starfish story when I'm doing my work. And I don't know if you know the Starfish story. The story goes, there's the tide has come in and all these starfish have washed up on the shore, and they're all, fluttering and they're all dying. And there's a young child throwing them back into the ocean, and there's tens of thousands of them. And an adult comes walking by and looks at the child with curiosity and says, huh? And then says to the child, well, what are you doing? And the child says, I'm saving them. the adult looks around and clearly sees there's tens of thousands of starfish and says to the child who's got a starfish in each hand, says, "Do you really think you're making a difference?" And the child pauses, throws one back in the ocean and says, "I just made a difference to that one," right? So often in public health, it gets to be weary. It gets to be, sometimes the days get longer than you want. And I think keeping that in the forefront of mind, because who knows, that starfish of today can turn out to be the Dr. Brian McDonough of tomorrow, and so it's so important to be mindful and to lead with compassion, to lead with helping as many people as we can, and giving each other inspiration and hope, and just lending a hand. And I think given where we are right now in the space of public health and in the space of time, that is something that we really need as leaders in the public health realm.
That's a wonderful, wonderful story.
It's not mine.
But also, you think about it, you've done this for 29 years. You have to, at least looking back on it, it's probably been a wonderful ride for you with the contributions you've been able to make and continue to make.
I get up every morning and I am truly humbled in this role, right? There are times, and it's funny, the staff, and I also lead with laughter. I think laughter is very important. And there are times where I've said to the staff, because I was in the role of deputy commissioner before, and I will say, well, please send me an email about it so I can make sure that the commissioner weighs in. And then they're like, duh, you are the, so it's a humbling, for me, I approach this role with gratitude, with humbleness in my heart. All of the experiences that I've had that I thought throughout the course of my career were like, why am I going through this? And now I'm realizing that those experiences are so useful, whether it's having been put to the test about our finances and learning how to understand the city budget, all of those things that I thought were just, why am I in this space, 15 years ago, 20 years ago, are all coming in handy. And I just am just grateful and humbled to be in this role and in this capacity with the most amazing staff that we have at the health department working together.
Dr. Palak, Raval-Nelson, thank you so much for taking the time and for sharing your view and clearly your understanding of the big picture. We appreciate it.
Thank you very much, Dr. McDonough.